long should it take me to write a progress note? Is it normal to spend an hour writing a treatment plan? While this answer might be a little bit different for everyone, in this video I'm here to give you some realistic guidelines about how much time you should be spending on your documentation. Hi, I'm Dr. Maelisa McCaffrey, founder of the free Private Practice Paperwork Crash Course, and today we are going to break down how long you should spend on all of the common forms of documentation. So we're going to talk about your intakes, your treatment plans, and your progress notes. Intake assessments are always going to take longer, and you should plan for that in your schedule. But they shouldn't take you hours to complete before or after a client leaves. Realistically, aside from typical scheduling stuff and sending emails, you'll probably spend about 20 minutes ahead of an intake session reviewing their documentation, making sure that their paperwork is completed as much as possible, and reading through what they've said they want to work on with you. Then you'll do your intake session and probably do a little bit more paperwork during that time. And then after the intake session, it's realistic to plan for about 30 minutes of documentation time. Now, during those 30 minutes, you might be revising any forms or filling in any gaps in the paperwork that your client completed, and you're going to be doing your intake progress note. What you are not doing is the entire intake assessment form that has all of their historical information and their contact information and all the nitty-gritty details. That should have been done ahead of time before they even came to your office. So these 30 minutes are for finalizing a diagnosis, reviewing any of that paperwork, formulating the case conceptualization, and doing that intake progress note where you outline that, yes, we did all those things, we signed all the forms we had to sign, and I got all of the information I needed to get. Now, if you're wondering, how do I get most of this paperwork done ahead of time and have the client fill it out? I have a video on that. So you can check in the description below, and we will link to some useful videos on all three of these topics: intakes, treatment plans, and progress notes. But specifically, I will outline how you can get your clients to do the paperwork ahead of time so that your intakes can go a lot more smoothly. Okay, let's move on to treatment plans. Now here, I believe you should never be doing treatment plans outside of the client session. This is literally a conversation with your client about what they want to achieve in therapy and how you are going to help them do that. So this is something that's super valuable to discuss with your client, and there's no reason that you should be doing this form without their involvement. Now, a good guideline for time frames is that really you should be able to get this done in about 10 minutes. Sometimes it will take a little bit longer, but that's usually because you're actually talking with your client about what their goals are and hashing that out and getting a little bit more detailed, or talking through support systems or things that you plan to use in therapy, or maybe even explaining the type of therapy you do and how you expect to work together. So if that's your conversation, there's no time limit there. You don't need to worry about doing the form more quickly because you're actually just having a valuable conversation with your client. The key here is to make sure that you're focused on how the two of you are working together and what you can expect from one another rather than filling out a form. So you can check out this video below on how to do treatment plans with clients and specifically how to actually create goals together so that you're meeting those insurance requirements and writing them in a way that makes sense for insurance, but more importantly, writing them in a way that makes sense for your clients and that feels easy to do in session. Now let's talk about the third and final thing that probably takes up most of your documentation time, and that is progress notes. I have talked with therapists who take 5 minutes to write a note, and I've talked with therapists who take 45 minutes to write a note. One progress note. So it varies greatly. So what's reasonable here? Ideally, you should be able to get a note done in about 5 to 10 minutes, maybe 15 minutes. If you're spending less than 5 minutes on a note, you're probably not making it really personalized or meeting insurance requirements. And if you're spending more than 10 or 15 minutes on a note, you're probably spending most of that time actually doubting yourself and doubting what you're writing and questioning what needs to go in the note itself. If you are like a lot of therapists I work with who are spending 25, 30, 40 minutes writing a note, yes, That is something that is not sustainable for your practice. If you're seeing 20 clients a week, that is way too much time to be spending outside of sessions just on progress notes, and you will get burnt out. We don't want that to happen. So 2 quick tips that you can use if you are spending a really long time writing each progress note for clients. 1, stop using full sentences and start using bullet points. Write everything in bullet points. If you can't use a bullet point in your EHR, just write a little hyphen or a dash and then write phrases, but stop writing in paragraphs and full sentences. It will get you out of that writing phase and it'll keep you a lot more succinct. The second thing you can do that'll help you write notes much more quickly, and it's very easy to implement, is to use an interventions cheat sheet. Now, you can use a cheat sheet for any section of the progress note, but I find that therapists probably spend the most time focused on how to write out their interventions. And guess what? Yes, I have a free interventions cheat sheet that you can download today, right now. So click in the description below, check that out. You can either use that to create some checkboxes for your progress notes so that you pull out the interventions you like from that cheat sheet and have them ready to use on your note, and you can just check them off really quickly. Or you can use it as a reference sheet, so you don't even have to do anything, you don't have to adjust your template at all, just have it next to you, read through it, and instead of worrying about how to translate what you're doing into the session, you're able to just reference that and write a couple of quick phrases. And remember, if you are someone who's spending 20, 30, 40 minutes writing a progress note, you're probably really conscientious and really, really worried about the content in that progress note. And that fear is not going to magically disappear because you downloaded my cheat sheet. It's not going to go away this afternoon when you start using it. So give yourself some grace through the process and expect that this will be a process. So try to move from 40 minutes to 35 minutes to 30, etc. But you do want to try to get that time down, because spending half an hour on every single client's note is just not sustainable. Now, my last point here is that yes, as always, there are exceptions, and there will be exceptions to this rule too. So if you have a really intense session and maybe a client was suicidal and you needed to create a plan together, you're probably going to spend more time on that progress note, and that is okay and very appropriate. So take your time on notes like that to make sure that you're documenting everything that you need to, you're documenting your rationale and the plan moving forward, and that you're following up on those things. Those notes always will take longer, and 20 to 30 minutes is probably reasonable for a note like that. But again, we want that to be the exception rather than the rule. So decide right now which of these strategies you're going to use. Just pick one, go ahead and download that cheat sheet below, and get to writing.